So the last question here is really about palliative care consideration and end of life. And I know that they're not exactly the same, but I thought I'd group this together because this is really a new area for exercise physiologists. And the experience that I've had here is really in the cancer context. And we think that there is a role for exercise physiologists or for exercise and physical activity at the end of life considerations or in palliative care. But this, like in anything, is really about what does the patient want and what are their real goals. And so, for example, we have a few studies running in women with ovarian cancer, another one in women with metastatic breast cancer. Now, not all these women are in palliative care, of course, but some of them do progress, their disease does progress during the study. And we always have to question ourselves and say, well, are we actually contributing to, are we adding something positive to this person's life, or are we just burdening them with more appointments to attend or more people to, or more things to do? And that's got to be a discussion with the patient in terms of, look, you know, you're part of this exercise study, or we've been doing this so far. What would you like to do? You know, the idea is really about maintaining function. That would be our overall goal. But that's not only just physically, but also emotionally. So a lot of patients find that actually by incorporating structured exercise, they find a sense of purpose, but it also a sense of control, because it's the one thing that they are able to do when they want to do it. And so it's just about regularly checking in and saying, look, are you still happy to do this? How often would you like me to come in? I can check in over the phone. And of course, we significantly modify the type of exercise that we do. But our goal is always about centered around the patient, the quality of life, and making sure that what we're doing is actually contributing positive to their quality of life, rather than burdening them more so. So overall, I think it's important, a couple of things, that the patient is in the center of all of our exercise programming, our exercise prescription, but the exercise prescription is always based around the individual circumstances, including the patient's medical condition, their treatment they're receiving, but also their lifestyle. Are they a carer for someone? Do they have a carer? Do they have children? What kind of job do they have? Because it's all well and good for us to prescribe a certain amount of exercise, but if it's not going to work for them and it's not going to be sustainable, then that's not going to be helpful. We also need to make sure that the exercise that we're prescribing is actually going to be helpful to the medical condition. They're going to get outcomes that will improve their overall either management of their condition, or, you know, reducing pain or reducing medication, or even just maintaining function, which is really, really important. And the last thing I'd say is communication. So communication with the patient, but also with their broader team. It's really rare that a patient will come in just seeing us or just seeing the GP. There's often other people involved, and I think it makes the patient feel like they're a whole person rather than just looking at one component of them. And I think communication is really key.